Shruti and welcome once again to Dr. Shruti's channel, a channel to help you stay healthy and stay happy. In today's video, we will be discussing about the 5 most common gynec problems. These are the problems that are encountered by most of the females at least once during the course of their reproductive years. That is beginning with the starting of periods or menarche as it is commonly known in the medical terminology, up till the end of the periods, cessation of periods or menopause as it is known. So without much ado, now let's get started. The first problem is that of white discharge in the women. As a gynecologist, the most common gynecological problem that we come across in our outpatient department, that is the OPD among the patients, is that of white discharge. If the white discharge is small in amount, it is occurring on and off, that is not on a regular basis, it is not associated with any bad odor or any sort of itching, then it need not be worrisome for you. As such, the vagina is not completely dry in any of the females. But if the white discharge is copious or large in amount, it is associated with a bad smell or itching, and it is occurring very often, then it might be indicative of infection, and you should definitely consult your gynecologist as soon as possible for the same. After a thorough history taking and pelvic examination, your doctor might advise you to undergo the pap smear, which is the screening test for cancer cervix, and also your gynecologist might advise you to undergo the ultrasound examination of the abdomen and the pelvis. Based on the examination and the investigation report, if the doctor or the gynecologist finds you to be suffering from bacterial infection, then you will be prescribed a course of antibiotic for a certain number of days for a certain period, and also the vaginal pessary, which is supposed to be inserted inside the vagina for a couple of days to get you rid of the bacterial infection. If the doctor finds you to be suffering from the fungal infection, then you will be prescribed a course of antifungal treatment. Do remember to complete a course of antibiotics or antifungal medication and also the vaginal pessary medication in order to get rid of the disease. Otherwise, the disease might flare up and it might lead to severe pelvic inflammatory disease, which might lead to complications in later life. So, if at any point of time you have been suffering from white discharge which is troublesome and worrisome for you, do comply with the gynecologist for the same. Coming to the second problem, that is of UTI or the urinary tract infection. The second commonest problem that we encounter among patients in our OPD is that of burning during micturition or the passage of urine, or dysuria or discomfort during micturition, or increased frequency of micturition. That is, you need to go to the washroom, you need to go to the loo very often. All these symptoms, that is the burning, micturition or dysuria or the increased frequency of micturition, these might be indicative of the urinary tract infection. In order to avoid the urinary tract infection, it is very important that you make a habit of taking plenty of fluids and at least 8 to 10 glasses of water per day. If your fluid intake is proper, then there are less chances of contracting the UTI or the urinary tract infection. If in spite of all these measures you are having symptoms of the burning or dysuria or increased frequency, immediately consult your doctor for the same. After history taking, the doctor might advise you to undergo the urinary routine microscopy and the urine culture sensitivity test, and based on the history taking and the investigation reports, if the doctor finds you to be suffering from the UTI or the urinary tract infection, then the doctor will prescribe you a course of antibiotics for a certain period of time, also along with the alkalizing fluid. Now it is very important for you to remember that you should complete the course of antibiotics whatever time it has been prescribed for you, for 7 days or for 10 days or for even a month long. Otherwise, if you're not complying with the medication, regular medication, then you will be having chances of having recurrent UTI or recurrent urinary tract infection. And if you are contracting repeated urinary tract infection, then it might lead to damage to the kidney and urinary tract. Also, a very important point to remember over here is that the diabetic patients, they are very much prone to have the white discharge, that is the pelvic infections, and also the urinary tract infections. So, you should always be very cautious if you are a diabetic patient. Also, as I pointed out earlier, do remember to complete the course of antibiotics prescribed by a doctor in order to avoid damage to your kidney and the urinary tract. The third problem that is very common among the Indian females is that of backache. Trust me, nearly 70 to 90% of the patients attending the gynec OPD, they complain of the backache. This is because of the low levels of calcium and vitamin D inside their body, and with the increasing age and with the childbirth, the calcium levels in the body are depleted, and so the chances of backache also increase. If you're also suffering from a backache, you should consult your doctor, and you should also go in for the bone mineral density or the BMD test. If the BMD test is indicative of osteoporosis, or if the BMD test tells you that your bones have weakened due to osteoporosis and there is depletion in the calcium levels as indicated by the serum calcium levels in the blood, then you should go in for a prolonged intake of calcium supplementation, and also the weekly vitamin D sachets should be taken. Now, it is very important for you to remember that if you want to maintain your calcium levels in the body, then you should have a regular habit of the intake of the dairy and the dairy products. That is, you should be taking milk and other milk preparations like cottage cheese or paneer, or milk in any other form like curd, which are very rich sources of calcium, in order to maintain the calcium level and not to suffer from backache. If you are not in a habit of regular intake of the dairy products, which are resources of calcium, and also if you are not taking calcium supplementation and vitamin D supplements, then there are increased chances of increasing osteoporosis, which might lead to repeated fractures of your bones. So please do take care. Also, in spite of taking vitamin D supplementation and calcium, if you are, in spite of all these measures, you are having backache, then you should consult a orthopedician for the same. Or if the backache is as a result of your trauma, then also you should consult the orthopedician for the same. The fourth commonest problem is that of PCOD or the polycystic ovarian disease. In the modern times, the changing lifestyle due to junk food and other instantaneous food, other unhealthy lifestyle measures, these lead to obesity, which in turn leads to hormonal imbalance, which in turn might lead to PCOD or polycystic ovarian disease, which is very much rampant nowadays among the teenage girls and the young females. So, if you are suffering from obesity, it might lead to polycystic ovarian disease, and the polycystic ovarian disease in turn might lead to hormonal imbalance, and in turn might lead to your menstrual irregularities, along with the triad of obesity and hirsutism, that is the increased unwanted facial hair growth, and also the skin problems like acne. So if at any point of time you are in the younger age group and also suffering from the menstrual irregularities, along with scanty menses and also obesity and skin problems like acne and hirsutism, immediately consult a gynecologist for the same. After history taking an examination, your doctor might advise you to undergo the ultrasound of the abdomen, which might give a clear picture of the PCOD. Now, very important point to be remembered over here is that PCOD is very much responsive to the weight loss. So, if you can manage to lose as little as 10% of your body weight, or if you can lose even 3 to 5 kgs of your body weight, then it will be very helpful in bringing about the hormonal balance, and you might get rid of the problem of PCOD. Do remember at all points of time that if PCOD is not taken proper care of, then it might lead to problems in later life also, in terms of childbearing and infertility and repeated abortions and other childbearing problems, and in later life it might lead to hypertension and endometrial carcinoma, and also the patients are more prone to diabetes. So if you are in a younger age group and also suffering from PCOD, please do remember to take the full treatment, be compliant with your medication in consultation with your gynecologist. Coming to the fifth most commonly encountered problem is that of heavy menstrual bleeding. If you are having heavy menstrual bleeding for just 1 or 2 cycles, it might be because of stress or some other changes in the body, which might lead to hormonal imbalance, and which might lead to increased menstrual bleeding in 1 or 2 cycles. But if you are having heavy menstrual bleeding in repeated cycles, then it is definitely very troublesome and worrisome for you, and you should definitely seek the advice of your doctor. After history taking, the doctor will do a thorough pelvic examination, and the doctor might advise you to undergo certain blood tests to rule out any hormonal irregularities, and also the doctor might advise you to undergo the ultrasound of the abdomen and pelvis to rule out any fibroid or the uterine tumor or other abnormalities in the reproductive system. and based on the reports, the further treatment will be decided. Now, a very important point to be remembered is that if you are having heavy menstrual bleeding near to the perimenopausal or near to the menopausal age group, that is, if you are having heavy menstrual bleeding in the age group somewhere between 40 to 45, 46, 47, then it might be indicative of the menopause, that you might be going in for menopause. But you should not rest assured at home, and if you are having heavy menstrual bleeding for prolonged periods of time, prolonged number of cycles, then you should definitely seek the advice of your doctor. If your doctor has done the history taking and examination and investigations, then she'll further decide based on your reports whether you should go in for the medical treatment or the surgical treatment might be decided, whether the sonography report shows any fibroid or uterine tumor, or she might just reassure you that you are going in for the menopause or the cessation of the menses. So friends, this was all for today, the 5 most common gynec problems. Hope you found this video very useful. If you like this video, then do press on the thumbs up or like button. If you're new into my channel, then do press on the subscribe button below, and do remember to press on the bell button beside the subscribe button so that you can get timely notifications for my further videos. We'll be seeing you all soon in the next video. Till then, stay healthy and stay happy, all of you. We'll be seeing you very soon. Till then, bye bye and see you.